Today, we're diving into a really fascinating question in the world of pediatric therapy. How do you help a child's brain and body start working together better, especially when you're talking about a condition like hemiplegic cerebral palsy? It's an incredible story about neuroscience, about creative thinking, and just the brain's amazing ability to change and adapt. So let's just start with this question right here. Imagine for a second a child trying to figure out the world, but one of their own hands just feels uncooperative, almost like it's a stranger. Now, this isn't just a physical thing. It's a puzzle that the brain has to solve. And the solution it comes up with is both brilliant and, at the same time, really limiting. And that solution, it has a name: developmental disregard. Now, what's so crucial to understand here is that this is a learned behavior. The child's brain, just trying to be efficient, figures out that, hey, it's way faster and easier to just use the stronger hand for everything. So it starts to just ignore the weaker one. This isn't laziness or anything like that. It's a super clever, but in the long run, self-limiting adaptation. To really get why these therapies are so groundbreaking, we first have to understand the condition they're designed for. So let's take a minute and break down what hemiplegic cerebral palsy is all about. Okay, so hemiplegic cerebral palsy, or HCP, is actually the most common type of CP you see in kids. The key thing to know is that it's unilateral, which just means it affects one side of the body. This usually happens because of an injury to the brain while it's still developing. The result is muscle stiffness. We call that spasticity, and it makes controlling movements really, really difficult. And a lot of the time, the arm and hand are even more affected than the leg, which, as you can imagine, creates a huge barrier for all those everyday tasks we take for granted, like buttoning a shirt or building with Legos, or just playing. So, faced with this challenge, the child's brain does something incredibly logical. It becomes a master of the workaround. It learns to work around the problem. And this is where that developmental disregard really digs its heels in. The child effectively learns to be one-handed, not because the other hand is totally useless, but simply because it's just so much easier not to bother with it. So how in the world do you convince the brain to re-engage with that hand it's been ignoring? Well, that brings us to our first major therapy. I want you to think of it like forcing a solo performance to remind a star musician just how talented they really are. This approach is called Constraint-Induced Movement Therapy, or CIMT for short. And the concept is, it's just powerfully simple. You gently restrain the stronger go-to hand with something like a cast or a soft mitt, and that's it. This forces the child to use their weaker hand for everything, for playing, for building, for eating. You're basically removing the easy option, which makes the brain confront that neglected limb head-on. The whole process really boils down to 3 core steps. First, you restrict the dominant hand. Then, and this part is absolutely key, you intensify the work for the affected hand. We're talking hours of structured, playful, and repetitive tasks. This isn't just about moving muscles, it's about fundamentally rewiring the brain. This intense practice fights back against that learned non-use and encourages what's called neuroplasticity, the brain's incredible ability to reorganize itself and build new connections based on experience. But what if the goal isn't just to make one hand stronger? What if the goal is to teach both hands how to work together, as a team? Okay, let's pivot to our second approach, which has a completely different philosophy. This one is called Hand-Arm Bimanual Intensive Therapy, or HABIT. And the first big difference you'll probably notice is no restraints. None at all. Instead of isolating the weaker hand, HABIT focuses on tasks that absolutely require 2 hands to get the job done. Think about it, trying to stabilize a jar with one hand while you twist the lid off with the other. The therapy is designed to make teamwork between the 2 hands totally essential for success. This really highlights the 2 different ways of thinking, doesn't it? CIMT is the soloist. It's all about isolating and strengthening that weaker hand to beat learned non-use. HABIT, on the other hand, is the duet. It's about integrating and coordinating both hands to build functional teamwork. So you've got 2 very different paths, but they're both leading toward the same ultimate goal: helping a child better interact with their world. Okay, so we have 2 powerful, evidence-backed approaches. We've got the soloist and we've got the duet, which of course leads to the big question, which one is the winning? And the answer from the research is, well, it's a bit of a plot twist. It's neither. Or maybe a better way to put it is that it's both. This is not a competition where one therapy just knocks the other out. The evidence is clear that both CIMT and HABIT are highly effective. The best choice really comes down to the specific goals you have for that particular child. So, Let's break this down. The greatest strength of CIMT is improving what's called unilateral skill, so the fine motor precision and quality of movement in that one affected hand. Habit, on the other hand, just excels at improving bimanual coordination for those complex real-world activities. So the question for the therapist becomes, are we trying to improve how a child writes, or are we trying to improve how they tie their shoelaces? The goal really determines the tool you're going to use. And in fact, what a lot of clinicians are finding now is that the most powerful approach isn't an either-or choice at all. As this research suggests, combining the two. Maybe you use CIMT to wake up the hand, and then you bring in habit to integrate it into daily, two-handed tasks. That can lead to the most significant, life-changing improvements. It's really the best of both worlds. But here's where it gets even more interesting. The research shows that the success of these therapies depends on way more than just which one you pick. It's not just what you do, it is absolutely how you do it. There are 3 factors that are just critical. The first factor is intensity. It turns out the dose of therapy makes a huge difference. For instance, one study found that a high dose of therapy, we're talking around 60 hours, led to significantly greater improvement than a lower dose. What that really shows us is that putting in that focused, concentrated time and effort is what really sparks those big changes in the brain. Next up is age. And you can see here, children under 5 tend to learn these new skills at a much higher rate. Why? Well, it goes back to that incredible neuroplasticity we were talking about. A younger brain is just more malleable. Its wiring is more adaptable, making it way easier to forge those new neural pathways. This really just hammers home the importance of early diagnosis and getting started right away to take advantage of that critical window of opportunity. And the third key is the environment. Where the therapy happens matters a lot. And doing therapy at home has massive advantages. I mean, you're using the child's own toys, their own kitchen table. It gets parents and caregivers directly involved in the process. This helps the child take skills from a therapy session and actually apply them to their real daily life, which boosts their motivation and just makes the whole thing feel more natural and comfortable. And this all leads us to a really profound conclusion. For therapy to be truly deeply effective, it can't just be something that happens for 1 hour a week in a clinic. The therapy room, it isn't a room. It needs to be the child's entire world. The playground, the classroom, the dinner table. So the ultimate takeaway from all this is pretty clear. There's no single magic bullet. The real magic is in creating a personalized recipe for each and every child. A recipe that combines the right therapy approach with high intensity, with early intervention, and with a supportive, real-world environment. That is what truly unlocks a child's potential. And that leaves us with a final and pretty inspiring thought. The science behind these therapies proves the incredible capacity of the human brain to adapt, to change, to reorganize. So if we can strategically retrain the brain to help a child reclaim the use of their own hand, it just makes you wonder, what other developmental challenges could we overcome? What else is possible?